Hi, I'm Lance DeLange with Yada Yada. Did your finger just do something weird? Perhaps you felt a pop, pain, discomfort, and now you notice that the tip of your finger is bent and you're not able to fully extend it? Perhaps you have a problem called mallet finger, and if so, you're going to want to watch this video. Mallet finger. This is caused by the failure of the tendon or the bony attachment where the tendon extends to the tip of the finger. The extensor tendons that come along the back of your hand that allow you to extend your fingers, there's a tendon that attaches at the tip of each individual finger. When this tendon that attaches at the tip of your finger, when it fails and perhaps tears, or perhaps if the bone fails at the tip of that and pulls off, you may have a problem known as mallet finger. When this occurs, you may notice as you extend your hand that the affected digit has a lag at the tip of your finger. As you try to extend your finger, perhaps it looks like this. And this could occur with any of these fingers. As this occurs, the tendon attachment has failed. Perhaps it was from an injury, perhaps gripping something, smashing it. There's a variety of ways that this could occur. But your finger should be able to fully extend, and if you notice that suddenly you have a lag with the finger stuck in this position, this is known as mallet finger. That's the cause. How do you treat mallet finger? When this tendon becomes detached or the bony attachment fails, this may require surgical intervention, but not always. It can be treated conservatively, dependent on the nature. It is important, however, if you feel you've developed mallet finger, it is important to seek medical attention quickly. If this goes untreated for a period of time, it may become an irreparable or untreatable problem, permanently leaving you with the inability to fully extend that finger. One way to know if you have this is if you can passively extend it, if you can take the tip and fully extend it, but then when you try to keep it that position, if it immediately lags back down, that's a very common sign that you have mallet finger. If this has become detached, you need to seek medical attention and have it evaluated and treated. Your healthcare provider will most likely first obtain an x-ray to determine if there is any bony involvement. Depending on the size, the treatment could be surgical, but it is quite commonly treated with a splint, extending the finger into its natural position and keeping it in that extended position. When this is done as a treatment, it needs to be left in this position for an extended period of time, allowing it to heal. If you have been placed in one of these splints and told that you have mallet finger, you may be tempted after a period of time to take the splint off to monitor your progress. This is not a good idea. Any healing that may have occurred may then be compromised. Sometimes people might remove a splint and say, aha, it is healing, I'm doing well because look, I can keep my finger straight. Until they flex it to test it and then notice that they can no longer fully extend it and they're back with a recurrent mallet finger. So it is important that you follow the advice given you in keeping this finger in the proper position if you are being treated in a splint. If surgery is required, your surgeon would have to discuss with you the pros and cons of surgery and how the treatment is to be performed. But the basics behind it would be to reattach the bony fragment or the tendon fragment to the tip of the bone to once again allow the finger to perform its normal tasks. There will of course be a healing time that is required to allow proper healing with this. Dependent on your specifics, be sure to ask this question on what your treatment time is, how long it will take, and when it is safe for you to return to normal activities. Because, as mentioned, if you test this out on your own, pull it off, the splint off, or bend or move your finger before directed, you may compromise your treatment, being left with a permanent condition where you can no longer extend the finger. So, let's hope you don't have mallet finger, but if you find your finger is stuck in this position and you're unable to actively extend it, please seek medical attention. Though it is not an emergency, you do not want to delay an extended period of time as you do not want this process to become a permanent problem. Good luck to you, and we hope that all is well. Stay safe. Thanks for checking in with us. Have a great day.